Welcome to Barbells Business and Boobs, where we discuss navigating everyday life as lifters, business owners, and being a woman in a male-dominated industry. Today we are recording on Valentine's Day, so happy Valentine's Day. And
Happy Valentine's Day.
Christy and I are doing an episode kind of about love. I guess it's about loving yourself. We're going to talk about mental health and sharing some of our personal stories. We got some questions. People wanted to do dating horror stories, but I feel that this topic is very prevalent right now and really important to discuss. So we're excited.
Yeah, we always get questions about mental health and everything, especially revolving around like us talking about injuries, being athletes. We have clients, so we hear a lot about their own struggles, like being a coach is often sometimes like a therapist, and you're a friend and you hear a lot of these stories too. And I know that we've had our own struggles that can be hard to talk about. Like, that's why I am so glad we made this podcast, is because sometimes Instagram and the other social media platforms we're on are so curated, and like you are always trying to, like, you're being vulnerable, but you also have to be a little bit guarded of like what you say and talk about. So that's why I'm like glad we have this platform, so we can kind of talk freely about these important subjects. I know everyone can relate. Like, everyone in their lives has like had a bottom. And I know, but there's also people like us who suffer with anxiety and depression, like generalized throughout our lives, and that people can relate to that too. So super important. It's funny that we're like quote unquote excited about this episode, like more so than dating horror stories. But I think it's just because we know it's so important, and it's good to get our thoughts out there and our experience out there, and hopefully it'll help someone.
Yeah, whenever I've talked about it in the past, I've always been pretty shocked at who's come forward and shared their own stories. A couple years ago, I partnered with Microsoft. They were doing a mental health panel, and I was promoting it, and I was just blown away by the amount of people that shared their own stories with me. And that's when I kind of realized that strength sports, bodybuilding, powerlifting, strongman in general, I do think that they attract people that are more prone to depression and anxiety because it's a way to gain control. You have full control over the amount of weight on the bar, what you're able to do to your body. And I think that's both healthy and unhealthy in a sense. So, Christy and I kind of want to dive right into it. Christy, when did you first kind of realize that maybe you had anxiety? We probably didn't even know what anxiety was when we first experienced it.
Yeah. So I feel quote unquote lucky because I experienced anxiety when I was really young. And so by the time I was older, I knew a little bit better how to deal with it. And I know recently with the pandemic and everything, like, I feel like a lot of people got anxiety for their very first time and like didn't know what to do, or like didn't realize what it was. But anyways, going back, I've always been a very highly sensitive person, super just sensitive in general. And when I was about 10 years old, I started to get panic attacks. So this is not just like I'm scared or, freaking out, or I'm anxious about something. It's when you have the physical reaction of like your heart rate really rises. I would start to kind of like get body flushes. I feel dizzy. I wouldn't be able to see. Um, and so these are legit panic attacks. I'd be kind of like paralyzed in fear. It was like an intense physical reaction. And sometimes they have triggers that and sometimes not. It could just randomly come on. So this would happen in school. And this was all based around, it sounds really silly now, the fear of throwing up. I was always scared I was going to like throw up at school or something like that. So, and when you are going through a panic attack, you also might have your stomach hurt. You might feel like you're going to throw up. So like you're kind of like, I am going to throw up, and then it kind of feeds into that fear. So I really struggled with that, so much so that I was put on medication at 10 and going to therapy. I missed a lot of school, like so much so that became a problem. I was in the nurse's office every day. It was a really hard time. So of course I say I'm lucky I had it when I was younger, just because I'm glad that, made me who the person I am today. But um, it came in waves on and off, and even through high school. But it was probably the worst in fifth grade, eighth grade, and then maybe like junior in high school, um, with the panic attacks. Now I've learned how to deal. I had learned how to deal with them, but I don't get panic attacks anymore. But I do definitely go through bouts of anxiety and depression. I think anxiety is. I don't like to think that I like have an anxiety disorder anymore. I almost feel like it's kind of just part of my personality now. You know, like the perfectionism or just obsessing over, my passions or my work. Um, Being really in tune and empathetic with people. I think all that kind of ties in to who I am, but I still struggle with it. Not as bad anymore. I feel like lately I've had some blips of feeling not anxious and being like, wow, this is get a lot done when I'm not distracted by this anxiety, which is amazing. So yeah, that's long story short, like if you're struggling through that and or if you've been like, oh wow, Christy's her shit together or she's a strong person, it's like I've also have dealt with these other things that a lot of other people have dealt with. And so yeah, it happens to everyone. So I definitely feel like that has really affected who I am today and how I do things. And although I didn't have sports really growing up, I kind of shied away from those things. Now, the gym and having somewhere to put my anxious energy into really does help. Um, so yeah, do you have any similar experience like with like your mental health, like through childhood through now?
I do, and I first just want to say you've been so helpful the past few years, like when I do have those really bad bouts of anxiety, because with our job and the nature of social media, like sometimes the pressure just gets a lot. And like you said, you pointed out certain terminology like perfectionism and like empathetic, and that's part of anxiety that is a positive trait. I don't think people realize that there is positives to having anxiety. So, from my own experience, I didn't realize how to diagnose it until later in life. So, when I was younger, I was a problem child. I always got great grades, but I just could not sit still. Like, I always got excellent effort. I got great grades, but like conduct would need improvement. I just could not sit still. I'm still like that. And so my mom took me and we tried multiple ADHD medications, and she didn't like how they made me act. Some were making me like a zombie, some wouldn't make me eat. So she instilled this discipline in me. Like I had to walk to school no matter what the weather was like. I thought she was being mean, but now I can see that it was just kind of helping me get some of my extra energy out. Later, I actually worked in the field of ADHD, specializing in CNS and various medications, and I learned that ADHD is more likely to be passed down through hereditary than eye color or height. So a lot of people have it, and it's also very, very likely to be a comorbidity with stuff like anxiety and depression. So I remember, I didn't know it was called a panic attack, but I very clearly remember my first panic attack right around the same age as you, around 10. I
Hmm.
was visiting my real dad, and I was just in a really bad situation. And I remember like not being able to breathe and my heart rate going out of control, and it almost felt like I was looking through a kaleidoscope. Like I didn't know what was going on. I felt like I was having like an outer body experience. And it's never been that bad again, but I didn't really tell anyone. And I would say it wasn't until I worked for myself that I started experiencing really, really, really bad anxiety again. And kind of funny because being so like, I'm someone that I want to dive in and research things and figure out why. So it was interesting. So when I was in a plane accident a few years ago, I tried to figure out why I didn't have an anxiety attack. Like that would induce an anxiety attack on most of the world, right? Like,
Yeah, I have anxiety attacks or close to it when I get on the plane. So I think of you every time I'm on the plane. I'm like, Brittany got through that. It's just crazy. But yeah,
so, but I didn't have an anxiety attack. I was actually the calmest I've ever been in my life. I
right.
felt in control. And so I went to therapy and I'll ask myself, like, why will I have anxiety about maybe our podcast not being perfect, but I could go through like a plane crash. And when I was talking to my therapist, like doing
Oh
some
yeah.
research, it said people with ADHD, like we actually get like a serotonin and dopamine dump, so that when we're in such a chaotic situation when there's so much going on, we're able to hyper focus, which makes sense because that's kind of
Oh
how I
my
always took
gosh.
it out. Like when I was competing, I've always done solo sports. I've always loved the feeling of when I can really, really hyper focus and hone in on something. So I don't take medication for it. I've tried off and on a few different things. I don't like stimulants. I'm happy to share more about that later, but I want to I don't want this to be a 2 hour episode, and I want people to get the full feel for it. So
Hmm.
I want to now talk about something that is really important. Is you said you started taking medication when you were 10? Is that correct?
Yes. So I started taking medication when I was 10. It was Xanax. So that was something you could just pop and right away it would calm your panic attack down or calm yourself down. And I also started taking antidepressants, going through, like you said, trying a bunch of different ones. Um, just everything, SSRIs, different, like almost like sedative type medications. And I don't want people to say, oh my God, she was 10 on medicine. How horrible. Times have changed, but also sometimes medication is the proper intervention. I don't want anyone to feel ashamed that they have to take medication. Personally, now, as someone who was on medication from that point for until I was 31, I think so it was over 20 years, um, I am more so against medication, or at least long-term medicating, but I'm not saying don't take medication. Um, but yeah, I started taking medication when I was 10 years old. And I do think it was the right intervention. The problem came when it was, all right, I guess I'm quote unquote better now. Or when do I get off? Do I ever get off? Why I'm just been taking these pills my whole life. So that's kind of when um, that came up. But yeah, I started when I was 10.
Okay. What kind of gave you the motivation to think about getting off in the first place?
So I think honestly, just being self-employed too helped because you know how it is getting health insurance, it's hard and then medications cost money. I was moving around a lot, so going to different doctors and stuff. So I wasn't exactly even seeing a therapist anymore. I felt stable, I was like, I'm not going through anything. And I actually, honestly, the first time I tried to get off, I was going through something. It was when I first moved to LA. But um, one of my, I was kind of like sick of taking medication, but every time, like if I skipped a day of medication, I would start to get withdrawal effects. That would really affect me physically, and I couldn't focus on anything. It was really horrible. So I just kept taking them. But the first moment that I was really inspired to get off them is when I moved to LA. Honestly, I didn't admit to myself I wasn't in a very good mental place. I was kind of running away from my problems at that point. But my friend told me, maybe you're slow, like, because I was kind of like, I'm a little ditzy sometimes, and also like a little bit. I wasn't very as explosive back then with my training and powerlifting, and I was really hurt, kind of. So I was just like very slow. And my friend said, maybe you're slow because of SSRIs, and that really got in my head. That like
Hmm.
I basically define myself as slow, like mentally and physically. And so now looking back, it's probably because I was highly stressed, highly injured, and I had low thyroid. So that also affected like my cognitive function and just my overall well-being. And I was just super stressed. So that really got in my head. So I got really motivated at that point to get off the medication. And in the past, my doctors have told me, and this is how they'll tell you, um, slowly taper, start taking three-quarters of the pill for like 3 weeks, 4 weeks, a half a pill. So I start doing that, but even though I would do the slow taper, eventually, like when I get down to a half a pill, I'd start getting withdrawal side effects, which would be some brain zaps is what I call them. Like it feels like a zap in your brain, and they're really distracting. Just feeling really tired, feeling very sad. So like these things made like just daily life very hard. So then I end up taking them again, and it wasn't because I was getting into kind of a manic, crazy, depressive state or anything like that, where, it's like, get me in the psych ward. I'm great. It was more of like a physical withdrawal. Um, and so that would eventually be so disruptive, I just end up taking them again. So that was my first real big attempt to get off. And that was in maybe like 2019, no, 2018. And, so I kind of tried again at here and there. But once I moved to South Carolina, I was in like a really good place. I was like, well, let me try, or I was like thinking about trying again. But we went to Norway and I made the biggest mistake. And it's just like how you should don't check your competition gear. Also, don't check your medication on an airplane. You should carry it on, right? Well, they lost our luggage and I didn't have my medication for the first like 4 or 5 days of our trip. And I was so nervous because I knew that these symptoms were grow, grow, and grow and grow of the withdrawal. Eventually, we got our luggage and everything was fine. It's not like any part of our trip was ruined, but that was the last straw where I was like, I hate that I might have to take this the rest of my life just because I don't think I can get off.
Wow.
So that was the last straw, really, for me. So, yeah.
Is that when now you ended up getting your luggage back, but did you go through a withdrawal? Like, how long did you not have the
I
medication?
started getting a little bit of like the brain zaps and just like, whoa, feel like it almost feels like you're like on a boat for a second. I started getting a little bit of that, but it wasn't enough. But it was mostly just me being so nervous that like it was not going to come. Like I was Googling places I can get medication, all this stuff, and so it's so annoying just to be controlled by a substance that you really don't even feel like you need. Like it's not like, oh, if I didn't have it, I'd be like depressed. It was just because it was making me feel physically sick not to have it. And it actually does have a name. It is called, I have it here. Um, Antidepressant discontinuation syndrome. So it's just the readjustment period as your neurotransmitter levels gradually return to their pre-treatment state. But for me, it's like been on, I've been almost like shaped by these antidepressants. Like they've altered the way my brain had worked for so long. So, it's going to take more than a couple weeks for it just to kind of like my brain to be like, all right, it's back to normal. Let's work like a normal brain without these drugs now.
Now,
So,
when you were transitioning, you finally I know you tried a couple times, but after Norway, when you decided to commit to it, what were you doing to kind of cope with some of the withdrawal symptoms and the brain zaps? And do you remember exactly how long it took until you felt that you were back to like stable
mhm.
levels?
Yeah. So, I just want everyone to know here too, a little like disclaimer, like definitely go through a doctor during this process and be going through therapy, having like oversight, have a really good support system. Don't just do what I say because I did it this way. Um, so, I at this point was a little bit newer to South Carolina. I just had this like nurse practitioner and I told her about it. And she, of course, was like, just taper down again. And so I did also get advice from Victoria Felker, who is really big on our industry. She knows so much about hormones, brain health, everything. It's so cool. So I did chat with her like the year prior about thyroid issues. So I kind of understood that all of these things kind of have cascading effect in your body. So I already had like a really good base of, I kind of leveled up my thyroid hormones. I was eating really well. I had this good health base first. But then I decided to taper. And like my doctor said, of course, they're just like, just taper a little bit and then eventually you'll be fine. And so I just did that again, really. And I just stuck with it, stuck through the discomfort longer. And luckily, nothing's going to happen. I do remember going on hikes with Gary here, and it was so weird, like just my thoughts. were so like, I was so determined to get through it. And just, I was just constantly, I was really reflective during that time of like everything I'd gone through. And it did make me feel a little weird and a little bit down and sad. Um, but eventually I just woke up one day and I was like, I feel pretty normal. Like I
Mhm.
don't have the brain zaps. Like I got through this and I have not been on medication for like 2 years. And it's just insane to me. It's like I thought I had to do that for the rest of my life. Or I was like, maybe I'll just like go to Hawaii for like 2 months by myself and just lay on a beach and just feel crazy for 2 months until like I feel normal. Like I seriously was like desperate at one point, being like, I don't want to do this anymore. But I mean, I'm just proof it's possible. I mean, like it was 20 years and it's just crazy. And I don't think the crazy thing, I don't think I feel that much different. I feel better now just because of different things I've been doing to just be healthier. But I mean, I can't believe I did it. I mean, it was just hard. I mean, it's not like I was like going through alcohol withdrawal and like on the floor, like shivering or anything like that. It was just like a day to day. It was, I'm still running my business where I'm just like, whoa, I feel like shit. Like how, like I have to hold this all together. I'm still training all that stuff, but I got through it. So, it just was crazy. So it's I just want people to know that, like, you're not weak for taking medication. If you need to be on it for the rest of your life, you do. But for me, I didn't want it to have a hold over me because that's what I felt like. I felt like I didn't need it. I was sick of having to go to doctors for things. And so I got through it and everything was okay. So that's my story of getting them off them because people in this age, it's very like, I feel like there's still a big stigma on mental health. Um, but I get ads for like prescription medications and like stuff about like mental health and taking depression medication. And people are really trying to normalize it, which is good. But also, what about the people who are on it and getting off and struggling? No one like talks about how hard it is to get off. So I think we need to know about both. Yeah, it's okay to get on, but know that like there's effects to everything you put in your body, and uh, just stay on them for 20 years because it's harder to get off, really. So that's what I would tell people. And also have a good foundation and base of health, like getting sunlight, walking outside, making sure you have nutritional deficiencies, stuff like that. And not saying that depression, anxiety can't coexist with like someone who has a healthy lifestyle. It sure does. But, you know, get off them before like, or to try and get off them is hard. Just know that it is possible because I really didn't think it was possible. So that is everything, which is crazy because it's like, wow, I can't believe I made it through that. But I did.
It
So,
does take an enormous amount of mental strength. So the fact that you shared your story because your brain chemistry is literally being altered and it's not just a quick fix. I want to compare it to kind of like weight loss or strength training. Like it's not just going to happen overnight. So the fact that you were working your own business and stuck with it, I feel like you had good coping mechanisms. Like you said, you were hiking and doing a lot of reflecting, and going through a period like that is so important because I feel, again, this is just my opinion. I have no problem with medication. I do think that there is a time and place, but I do feel very, very strongly, like what you did, that you should at some point try to get off or try to see how you feel with less of a dose or something because it's not natural. We also don't live necessarily in a natural world. 100 years ago, we weren't sitting at computers and on tablets all the time. We were getting more sunlight. We were walking around. So it's hard to say, but I kind of want to now transition into some of the things that you've done to continue to be healthy. And I'll share my own because I know that when I deviate from not doing like my normal routine stuff, my mental health starts to suffer. But being a business owner, sometimes things just have to be put on hold. So, what are some of the things that you do to make sure that you're always in a good place?
um, for me, waking up around the same time every day helps. Like getting out of bed, having structure and routine. I'm kind of like you where I it's harder to focus when it's like just me, like sitting at my desk, like and not having like a routine or structure. So that helps a lot. Getting outside a lot, like limiting time on social media. If I see myself scrolling a lot, um, like just being like, okay, I'm present here in the real world. This is what matters here. Because that can kind of like make me a lot more anxious. So those things help. Training, going to bed early, like not having screen time, going to bed. So those are things that help me, but I'm more curious about hearing. I know you have like a lot of really good rituals and stuff like that, so I feel like this is your topic.
Yeah, so I've kind of suffered off and on my whole life, and living alone and moving cross country and having no support for a while was a really, really difficult time. And I've even told you, like, there's been multiple times, like, I have a family member who has committed suicide. So I've always been very aware of like depression and that stuff. And I've definitely have had suicide ideation, no doubt about it, multiple times in my life. And I've always made sure that when I get like that, I now tell someone because I used to see it as a sign of weakness. And it's funny because I can kind of see through people that are really sad because oftentimes those people that look like they're doing the best, they look the most put
Mhm.
together. They're the friendliest because they're hurting so bad. So for me, it's really important, like you said, keep a routine. I can feel myself kind of degrading when I go to bed at different times because then I won't be sleeping and then I get anxious. And then if I don't take my walk in the morning and get enough sunlight, and like you said, if I just sit there scrolling, it's not a good recipe. And sometimes I just need to take a day off where I'm outside. That really seems to reset me. I find that the older I get, the harder it is to do that. But like once a month, I call it going off grid. And that's really important for me. And I have to make sure I keep up with it. And I don't always keep up with it. And then that's when I suffer. So I'm actually currently working through that right now. I've been undergoing some big life changes, and it's like I have really, really good days and really, really, really bad days. So I just try to, even on my worst days, I try to get dressed, and I try to do, I've done like gratitude lists, and then I'll try to call someone just to talk about it. I always make sure one thing I never ever do is I'll never just stay in bed. I always feel better if I just move or clean or do something productive, like try to tackle off a little on my to-do list, because the quicker I can get myself out of the rut and into more normalcy, the better.
Mhm. Yeah, and I think for people like us, like being alone, like I think it's good. You should be able to be okay with being alone and being at peace with yourself. Like you shouldn't always have to have people around, but like if you're alone with your thoughts and you're anxious and stuff like that and you're isolating yourself, it's always better to reach out and talk to people or try to at least be in the presence of people. For me, like it really resonated with me when you're talking about ADHD and how you focus better in chaos. And I was at the coffee shop this morning, able to focus on my work so much more that when I came here and I'm kind of anxious about just work stuff right now, just sitting here on my computer, not getting as much work done because it's just my anxious rolling in instead of just having you know it's easier, it's harder when you're isolating yourself and all you have is maybe your anxious thoughts when you're anxious. When you're not anxious and it's a lovely day and you're fine, yeah, that's okay. But if kind of know what makes you feel better and what makes you feel, I don't know, I just like to feel a part of the world really when I feel anxious instead of just like in my own anxious world. So I like to get out and about even if I don't talk to anyone. But so yeah, that really resonated with me. And I think it's really important that people like us talk about it. Like you being so honest, saying that you've had like ideation before and you are struggling through a rough time right now. I think is really important, especially in the strength community. I've been loving how like the Stoltmans recently have talked about a lot about mental health. And it's like when the world's strongest, one of the former world's strongest men, and world's strongest men competitors, and world's strongest woman, and stuff like that, talk about their mental health struggles. It just kind of breaks down the stigma a little bit and makes people think like, okay, this is okay. Like, I'm not lesser because of this. Um, and might empower them a little bit more to get help and talk about it a little bit more. And I think that's really important.
Yeah. No, I look at it. I recently finished reading Dr. Atia's Outlive, and it kind of goes through multiple facets of health, how to live longer. But at the end, he wraps it all together. He's like, okay, like he shares his own personal story of how he did all this research and this data for how to live longer, but he was an emotional wreck from trauma. Everyone has trauma. And he really brought it all together and talks about some of his own coping mechanisms. But he didn't realize this until he was in his 50s and almost lost everything he had, his practice, his kids. So it's never too late. Sometimes it feels like, okay, well, I've been dealing with my whole life. Like, it's just not going to go away. And I even tell people I'm dating, like, just so you know, sometimes I really struggle. I'm always going to be okay. But sometimes it's just like I go through a rough patch. And, the more self aware you are, the more you can see kind of the warning signs of when they're going to come. I think especially for women, a lot of it's triggered by hormones. So I'm currently working, trying to figure out my hormones because things have been off, my thyroid and stuff, and my
Hmm.
bodybuilding and dieting and pushing ourselves so hard in training definitely adds to it, which might be another reason why it's
Hmm.
so prevalent in our sport. I
Hmm.
don't know for sure, but we do alter our hormones
Hmm.
when you train as hard as we do and diet. So just something to point out.
Hmm.
I also would
Yeah.
love to have. Oh, go ahead.
Oh, I
Uh,
was just gonna add, like, being a little bit like in tune with your body and taking notes. I think the best thing that's happened to me is tracking my cycle on my iPhone. And so if I feel like I'm starting like kind of easier to cry one day, I'm like, oh, I'm starting the week, and this happens every single time, or I'm failing deadlifts. That's what happens. Um, and also just note being more just self aware when I get extremely tired, like I'm lack of sleep. Um, my mental health, like I can definitely have a bad day. And I'm like, honestly, it's like I'm like, the world's ending, oh my god. And then Gary's like, I think you're just tired. I'm like, oh yeah, I'm just tired, I'll go to bed early and then I'm fine. So it's like being a little bit aware of your actual needs and what your body's doing and going through is super helpful. I mean, like you said, like diagnosing underlying hormonal issues could be huge as well.
yeah, absolutely. I would love to have. I actually have a client who's an NP that I used to work directly with before she was a client of mine who does this, who always is talking about the stigma. And she actually pointed out to me she was just doing a research paper, and it's actually more prevalent in women because of our hormone issues. And also, she just did a research paper for grad school about how bad it's gotten because of social media and people just sitting down, getting lost on their phone. So
Yeah.
that would be a really fun topic to get into. But
Hmm.
I just wanted this episode to be, Christy and I will talk about it more in depth in the future, but I just wanted people to know that, they're not alone. These issues are definitely prevalent, but Christy's story of dealing with something for more than half her life and then being able to get off, it is possible. So if you take anything away from that episode, take that away, and please send it to someone that you know who may be struggling or trying to get off, because like we said, it's definitely not talked about.
Right. And another takeaway is knowing that even some of the strongest women in the world, like Brittany, struggle too sometimes. And, it just makes you stronger in the end once you figure out how to deal with it, and just make sure that you're talking to your strong friends as well, because they might be struggling too. And I know we've had a lot of friends in the community um, really struggle. And, it's always surprising who's struggling, and just gotta, you know, check on them and then check on yourself too. Like, don't. Like, it's not, life's not all about lifting weights. You know, you got to, like, if you are seeing yourself go down in a hole, like, don't just only treat it with beating yourself down more in the gym. You know, you owe it to yourself to, you know, maybe get therapy or take a chill pill, rest, or whatever you might need to get you through it.
Do you want to go over? I feel we answered some of them, but we asked social media some questions. One of them was how to get out of a rut, which I believe I already answered pretty
Hmm.
straightforward. I kind of recognize when I am and start to make sure,
Hmm.
Christy even said sleep.
Yeah.
For me, it's
Um,
yeah.
yeah. And someone said, like, how to mentally help yourself when you're injured, how to get through that. And we talk about that in our injuries episode. And then also an episode that uh, is actually being posted this Friday, but this is it's already going to be posted by the time this episode comes out, is the one with Nancy Johnson talking about her injury. We talk about a lot about staying in the community and being helpful in other ways. Like if you're injured, like still maybe volunteer or, you know, help people out at the gym, stay involved. Um, and we have just so many good, like, just like bits of how we got through our injuries in those episodes. I would definitely listen to those because there's so much. I feel I'd have to just ramble on about it right now, unless there's something else you want to add about how, like, maybe the biggest piece of advice of how to get through an injury mentally.
Yeah, so I was dealing with this because my normal coping mechanism, whenever I've been injured before, I've always kind of been able to walk. But right now, I'm dealing with a really bad knee injury that I'm actually probably going to get surgery on soon. So, what I started doing was going back to kind of visualization and picturing myself getting better and knowing that there is hope, even though when I'm lost in those bad thoughts and it feels like I'm not going to be able to do anything I love so much ever again. I try to picture myself, doing it again and knowing that it is possible because I have been through bad things. So visualization is important. And yeah, I think another question I got to was advice to my younger self. And some of the best advice I ever heard was actually when I was watching a wrestling documentary. And they said that depression and anxiety is just a demon that you need to learn to tame because it probably won't ever go away. It's always going to exist, but learning just how to tame that monster. And sometimes I'll
Hmm.
even talk to myself in like two different voices where it's like the negative voice and the positive voice. And I almost pretend I'm a friend to myself because it's like, if you reached out to me, Christy, how would I respond? Versus how I talk to myself sometimes. And I call my clients and my friends out on it. So I start checking myself like, okay, Brittany, don't talk to yourself like that. And that seems to actually really help.
No, that's super, super, super good advice too. The way you talk to yourself. I think something I've been working with this last year is just trying to be having a little bit more of a positive outlook on everything, like reframing things that I say to myself or events that happen. Um, let's say you get in a car wreck. It's like, damn, I'm so unlucky. I got injured. I can't train. Or it's like, wow, they're really lucky. They could have died, you know, and they're going to get through this and they're going to, you know, that's an extreme example. But I'm just saying, like, reframing things in your head to reflect a little more gratitude and a little bit more luck, you know, just seeing the good. If you like, the people who are lucky are the ones who just like look for luck, right? So um, being just a little bit more positive, which is hard too when you're going through a bad time, especially like when you see a lot of bad things in the world. I know, but it makes a hell of a lot bigger difference when, you know, so those little things don't add up. Like if you spill your coffee in the morning or something like that, you don't want those little things to add up to give you a bad day. So I know it's easier said than done, but a little bit of positive mental attitude goes a long way. That's for sure.
Yeah. And the last piece of advice I'd give is when you really are in that like extreme bad place where you don't see a way out, what I try to do, because I can get down the hole, is I really try and pause And even when I don't think anything is going right, I try to think of one good thing. And sometimes it's just like petting my dog. My dog is a very important part of my mental health. So I'll just like pat her and I'll think about how soft her fur is. And I try to use as many senses as I can, because when your brain's on overload and you have anxiety and depression, it's really hard to focus on the present moment. So I try to do like a little meditation where I'm just concentrating on what something feels like or what something smells like. And that, even if it's just for 10 seconds, that will temporarily take me out of that bad place. And the more you can do that, the better.
I totally agree.
So,
You think we should wrap up our episode?
yeah. So, again, I guess I made a joke earlier about loving yourself, but that's kind of how I wanted to tie it in, is like talking to yourself positively. And we would really appreciate if you would send this episode out to someone, because now that I am injured again, I want to actually shift my own brand and my own social media to help people more with this stuff and talk about things like this. So we'd really appreciate it if you would, if you're brave enough to even leave a comment about your own struggles. You never know who you're going to help, and share it with someone. We would really appreciate that.